We're talking about the shortage of Ozempic, which is frustrating for some diabetics, I can only imagine, but it might be offset by the arrival of a similar medication called Mounjaro. And we're joined by Dr. Tom Elliott, Medical Director of BC Diabetes. Thank you so much for joining us.
Good morning, Jennifer. It's good to be in the studio.
It's nice to have you here. Nice to have people back. So Ozempic and Mounjaro, we've been hearing a lot about these two. What are the differences?
Well, Mounjaro is newer. It's just been approved by Health Canada. It's just arrived in pharmacies in BC. It's more potent than Ozempic, so you get more sugar lowering and more weight loss. Oh. But most importantly, it's arrived right at the time where Ozempic is in a critical shortage. So nobody basically is able to buy Ozempic. So it's profoundly good timing for the manufacturer of Mounjaro, and of course wonderful for my patients and all of your viewers out there who are right on Ozempic currently.
Ozempic isn't, and even Mounjaro, you haven't really dealt with it too much because I guess it hasn't been released yet technically, yes. But how life-changing are those medications for type 2 diabetics? Well,
they're the single most powerful and useful class of drugs we have for diabetes. You know, it goes without saying, Jennifer, that lifestyle comes first, eating less, exercising more, low carb, low GI, healthy eating habits, not eating when you're sad, tired, lonely, bored, and anxious, and all of that. Yeah. But everybody does that, they do their best, and then we're left with high sugar and often overweight. So these two drugs have made a huge difference in everybody's practice of medicine.
And can they be used or interchangeably? Like, does it make a difference?
Yes.
Okay.
In effect, I'm about to send an email to all my clients suggesting they consider switching to Mounjaro.
Okay. And that's because of the shortage for Ozempic?
Just the shortage, really.
And so do you think, because you mentioned, Mounjaro is maybe good for weight loss as well because it's a stronger, more powerful type of drug. Yes. Do you see the same thing happening there that happened with Ozempic?
Yes, it's going to get prescribed off-label for people who don't have diabetes who just want to lose weight, for sure.
Okay. Were you surprised by how popular Ozempic was for that purpose?
Not really.
Okay.
You know, I was very surprised when this massive shortage occurred. I just didn't think it would happen, but it did. The manufacturers just couldn't keep up with demand.
Okay. For someone who thinks they're not feeling well, what should they be looking for if they think they might have diabetes? Or maybe, again, they're just not feeling well. What symptoms should they be looking for?
Well, you know, by the time symptoms have occurred, people have had diabetes for 5 years. So really, if you've got a waistline, if you're not doing any physical exercise, you should be doing it. You should be eating wisely. We already talked about it. Low carb, low GI, healthy habits. So that's in the first place. If you're thirsty, if you're losing weight, if you're peeing a lot, those are cardinal signs of diabetes, and then you must go to your doctor and get a test done.
Okay. Well, thank you so much for coming in and explaining a little bit about these two drugs because they are all over the headlines. And like you said, you're going to be talking to your patients very soon here about it. So thank you for your time.
My pleasure, Jennifer.
Dr. Tom Elliott with BC Diabetes.